charter, which we'll touch on a little bit later in this presentation. So following from the mission are our goals. The first two, of course, come directly from the mission: high quality, affordable benefits, and limiting that financial liability. The third goal, just a word about that, because we at the GIC have so many members, over 400,000 members, we have the opportunity to influence the healthcare market for the entire state, even beyond the GIC, and we take that responsibility very seriously. Finally, we're focused on being as efficient and effective as we can be as an organization so that we can serve you well, provide you the tools and guidance to manage your benefits. The GIC team is working very hard to improve the way we operate. We have a small staff, smaller than you might think, so it's important for us that we be as efficient as we can be in serving you. So on the next slide, just a quick reminder of the range of benefits that the GIC offers: health, dental, vision, life, and long-term disability insurance. We also, as many of you likely know, manage healthcare and dependent care flexible spending accounts, as well as the Mass4U Employee Assistance Program. Just a quick note that not all of the offerings here are available to all GIC members by our statute. For instance, the flexible spending accounts, or FSAs, really designed for employees, so we offer those to our active state employees, but cities and towns frequently offer their own such programs. And also the Employee Assistance Program, by its name, having employees in it, is provided only to active state and municipal employees. But message here is we offer a range of services to our members. So some key facts about the GIC. We have about 455,000 members, including about 110,000 retirees. This makes us the largest purchaser of healthcare in the Commonwealth of Massachusetts. And to do that, we have an annual budget from the state of about $3 billion. We are governed by a board, a commission, a 17-member commission. You'll see some of the membership listed here. It represents people from a variety of different backgrounds and areas of expertise, including 5 union representatives, 2 from municipal government, a health economist, and a retiree. And we work with a wide variety of public agencies. I think GIC is thought of generally as serving the state and cities and towns, but we actually work with a wide variety of public entities all across the state at the state, regional, and local level. So here's just an illustration of how the GIC's benefits are funded. Most of you will know this, but the Commonwealth of Massachusetts, through the state's budget, funds a significant share of your benefits. That share will vary depending on your date of hire. Cities and towns that choose to purchase insurance through the GIC for their municipal employees also fund a portion that's highlighted here in green. And of course, you, our members, also pay a portion of your premium, which in most cases is through a deduction from your paycheck or from your pension. So on the next slide, I don't want to get too much into the weeds here, but I do want to note that the GIC's benefits are financed in a little different way than you might be used to, particularly on the healthcare side. The GIC is self-insured, which means that the GIC, essentially through the state budget, holds the insurance risk and not the insurance company that you may be enrolled in. So when you as a member receive healthcare services, your doctor sends a bill or claim to the insurance company, and that insurance company then in turn pays the doctor for that service. The insurance companies then bill the group insurance commission on a weekly basis, and we in turn reimburse the insurance company for those claims. So an important implication for this, of course, is that if over the course of the year our members use more healthcare services than expected, it's the state that pays that additional cost. You, the member, do not. And if members use fewer healthcare services than expected, the Commonwealth may spend a little less, but not the insurance. The insurance companies don't make more for less healthcare services. We pay them on a fixed fee based on how many GIC members they have enrolled in their plans. So a little bit of background about how the financing works. So the next slide is just a brief reminder. You can move to that next slide, that you may submit questions at any time during the presentation, as Erica said at the outset, using the Q&A tab, typically at the bottom of your Zoom screen. We will review those questions real time, answer as many of them in writing as we can, but you may also view our FAQ document for information on most topics. That is linked here on the slide. Also, again, as Erica noted, we want to protect your privacy. So if you have questions that are specific to your coverage or personal in nature, we encourage you to reach out to us by phone or with written comments as noted at the bottom of the screen. All right, so moving on to our next session, which is a reminder of all the insurance companies that we work with to provide you your benefits. On the healthcare side, really nothing substantive is changing here, but there are a few other changes we want to note for you. For pharmacy benefits, sorry, if you can go back, there you go. There are no changes to the company that provides our pharmacy benefits. If you're one of our active employees enrolled in our active plans, CVS Caremark provides you those benefits. If you're on one of our Medicare plans, it's CVS similarly, but through the SilverScript program, they will continue to provide your benefits going into the coming fiscal year. No major changes to the plan. But as always, just a reminder that CVS may make changes on occasion to the tiering of a particular drug that you may be taking or the formulary through the course of the year. Similarly, the company Task that we moved to last year will be providing services for the flexible spending accounts for our state employees. So no changes here. On the health insurance side, we'll continue to offer the same plans that we have since fiscal year 2024 and this current year. There are no changes to these plans. Do just want to note no changes we're expecting to Health New England, which will continue to offer coverage to members in the western part of the state. As we'll talk about in a minute, unfortunately, our premiums are rising pretty substantially this year. So if you like the plan that you're currently enrolled in and don't anticipate making a change, it's still a good idea for you to log into our member portal, review your member benefit guide. Always a good idea to evaluate other plans to make sure that the one that you enroll in meets your needs. So this is annual enrollment is the time to make those decisions, and we encourage you to be active and involved in that this year. And similarly here, we will continue to work with the same companies to provide your Medicare benefits. On the left-hand side, you'll see the 3 Medicare supplement plans that we offer through WellPoint, Harvard Pilgrim, and Health New England. And on the right-hand side, our Medicare Advantage plan. called Tufts Preferred. So again, no changes to any of the plans that we're offering here. Now, with that, I'm going to turn it over to my colleague, Cameron McBean, who manages our work with our various vendors to walk through some changes that we are making in the dental and vision section of our benefits. Cameron?
Thank you, Matt. We wanted to take this opportunity to let those GIC members who participate in either the active state employee dental and vision plan for our non-union employees, or who may be on the retiree dental and vision plan, that we will be changing carriers for the fiscal 26 plan year. We have been with MetLife for a very long time and Davis Vision, and we will be moving to Altus Dental, who is going to be partnering with VSP to provide the vision coverage. As a result of this procurement, we were able to secure lower fully insured premiums for both the dental and vision plans, and that is going to allow us to increase the annual maximums for all three dental plans. That's the two plans available for active non-union state employees, as well as our retiree plan. That means that the dental carrier will pay a larger amount for dental care. So say you need to get a crown or a root canal or some expensive procedure, you will have a larger portion of those claim expenses covered. And then on the vision plan, we've made a couple of enhancements as well. We will be moving to covering participants in the active vision plan for an annual exam. Currently, it's every other year. If we could go back to the dental slide, and then currently on the retiree vision discount plan, in order for members to utilize that, they have to prepay with a voucher sent with a payment directly sent to Davis Vision. You will no longer have to do that. You can go to a participating provider and receive the discount at the point of sale. Next slide, please. We're going to move into a brief discussion of how the premiums are determined for the GIC as a self-funded entity. So beginning in the fall, we start working with our actuaries and consultants to establish what we expect the next year's medical costs to be. That process formally begins in December, where we present our preliminary pricing changes. At this point in the year, we're doing these public information sessions, trying to finalize any plan design changes, take into account the financial impact. Next month, the commission will vote to approve our projected premiums, and then we move into annual enrollment and then coverage taking effect July 1st. Next slide. So these preliminary budget increases, as I mentioned, we consult with our actuaries, we consult with our medical carrier partners. We take a look at what is going on in the broader Massachusetts marketplace, and we come up with a projection of an estimated range of increases. Initially, back in December, we were looking at a low end of 6%, high end of 12% within the Massachusetts marketplace. The GIC is looking at somewhere in the higher end of that range based on all our best data and evidence to this point. Next slide. So why are these premiums so significant this year. Uh, Healthcare costs are going up across the board for everyone. It's not specific to Massachusetts. It's not specific to one region or market. It is a nationwide problem. Prices charged by doctors and hospitals are increasing higher than the rate of inflation, and prescription drug manufacturers continue to increase prices. And some of the new drugs that are in the pipeline or that have become broadly available, especially those for weight loss and diabetes, are, the more popular they are, it creates so much pressure on us when we've got to cover those costs. Next slide, please. So we do have some minor plan design changes that we plan to incorporate on the medical for the medical plans for fiscal 26. We've accepted an offer to partner with Hinge Health through our contract with CVS. This is a app-based assistance for those with musculoskeletal conditions, so muscle sprains, strains, joint damage, etc. We are intending to harmonize and enhance the fertility benefits across all of our medical plans so that no one plan offers better reproductive assistance than any other. And as part of the move towards mental health parity, we will be removing any current limits on nutritional counseling. Next slide. So at the very end of 2024, in late December, the Massachusetts legislature passed the PACT Act, which will have some moderate impacts on the GIC. The financial impacts for the plan's total liability are relatively minor, but there will be some direct beneficial impacts for those members who are on any of the medications under the jurisdiction of this law. It offers no cost sharing, so free at the point of sale prescriptions for generics for a number of conditions, as well as reduced cost brand name purchases. Next slide. We've also had a number of other legislative mandates that have passed within the last year or so. We are very pleased to announce that those GIC members who qualify for our basic life insurance benefit, those active and retired state employees, the basic life and A&D benefit, which has been $5,000 for a number of years, was authorized to increase to $10,000. We've also enhanced coverage for breast cancer screening using advanced imaging techniques, coverage for human donor milk and postpartum services, changes to pain management mandates, and then also additional mandates for coverage for those members or their dependents with Down syndrome. Next slide. And I believe we're now ready to hand things back over to Matt. Or no, I'm sorry. This is going to Paul Murphy, our Director of Operations.
Thanks, Cameron. If you could go to the next slide. So what we want to do here is we want to remind members that our annual enrollment period is going to be April 2nd through May 1st. During this time, members can make changes to their health insurance plan. They can enroll in GIC benefits. They can withdraw from GIC benefits. They can change plans, and they can apply for the GIC buyout program. The benefit decision guides are going to be available immediately prior to the start of annual enrollment. Once they're available, we will be communicating out to agencies. They will be online in our website, as well as the GIC member benefit portal, but they won't be available till roughly the end of March. In the guide, we will have information regarding the new dental carrier. We will have phone numbers, updated email addresses, website addresses for our vendors, as well as all of the new plan rates. One thing to keep in mind about annual enrollment, we encourage all members to review their benefits, look at what's happening during annual enrollment, review the benefit decision guide, see what's new, any changes that are coming up. But if you are not making any changes and you wish to keep the same benefits that you had with GIC, no action is required. We do not require our members to re-enroll in a plan. If you are keeping your current health plan, no action is needed. If you could go to the next slide, please. On this slide here, we'd like to remind all of our members that the GIC launched a member benefit portal in 2021. We have about 112,000 members registered for our portal. You can register for our portal at any time during the year. We encourage members to register for the portal before the annual enrollment period. The portal will give you real-time access to your benefits. You can make changes during annual enrollment to your benefits. You can apply for benefits, make changes with a qualifying event throughout the year. The portal is our preferred method that we'd like members to use when updating or changing their GIC benefits. But again, it's only one option. You as a member can still submit forms to the GIC electronically through our online forms on our website, or you can print and download forms and you can complete them and mail them to our vendor, and you can send them in during annual enrollment. So there's three options, one being the portal, the second being electronic form submission, and the third being download the forms, complete them, and mail them to the GIC. All forms have to be in the GIC by May 1st, but we encourage members, if you use the portal, it's real-time changes. You get the access, your coverage is immediately gone into the GIC system, and benefits will be effective July 1st. So that's our preferred method. If you wish to use it and you are having trouble registering for our portal, you can contact the GIC, our Public Information Unit, directly, and they can assist you with helping register for the portal. You could go to the next slide, please. What we are providing here is our health plan contact information and website. So we provide this information to you this year during the listening sessions, but we also provide it for all of our vendors in the benefit decision guide. The last page of the guide will give you all of the phone numbers and websites for all of our vendors, including dental, long-term disability, and any other benefit we offer. A couple of things to keep in mind here. We like people to contact their health carrier for finding a provider. If you're looking to see if your doctor is in a doctor or hospital participates in the plan, we'd like you to contact the plan directly. GIC doesn't have access to this information. If you like to know what benefits are available, like telehealth or fitness, you have to go through the health insurance carrier. If you want to understand what benefits are covered and what's not, again, you have to go through the health insurance carrier. A lot of times during annual enrollment, GIC gets requests for new ID cards or replacement ID cards. The ID cards come directly from your health plan, and you have to call your health plan directly to get any new ID card or replaced ID cards. And the next slide, I think we're turning it over to questions. Yeah, I can turn it back over to you, Erica, if you want.
Thanks, Paul. Thanks. So we've gotten quite a few questions in the Q&A function, some of which I think about 60 of which have already been answered, which I believe you should all have access to view. We have currently 43 open questions. Some of them are the same, so we'll try to tackle some of those all together. So the one that we often get, Paul, and I know we were prepared for this, is about retirement. We have quite a few questions about retirement, how that process works, and really just if we could review the basics, I think that would be most helpful. And Emily will also include in the chat function a link to the Turning 65 video that we produced some time back to help folks understand what they need to do for retirement. So Paul, if you could give your overview, that would be really helpful. And I think we'll answer quite a few of the questions that are lingering.
Sure, I can give a high-level overview for members turning 65 and what happens to the GIC coverage. Again, it's going to be high level. Different people have different situations, and different people have different scenarios regarding the number of dependents that they cover under the plan. But what I can do now is give you some common scenarios that may answer some of your questions. The first one is, if you are retired and you are turning age 65, and you have a spouse on your plan who is also turning age 65, the GIC will contact you 3 months before your 65th birthday, giving you instructions on what you need to do to enroll in a Medicare plan with the GIC. Your spouse is also turning 65, will also receive a letter with instructions on what to do to apply for your Medicare benefits. Please keep in mind that under state law, if you are retired and you are eligible for Medicare, state law requires you to join a Medicare supplemental plan with the GIC. All of that is spelled out in the letter we send you 3 months before your 65th birthday. A lot of times people ask us, do I have to do anything during the annual enrollment? The answer is no. People turn 65 all year long. We send out about 500 letters a month. So if you're turning 65 sometime in the future and you are retired, we will send you a letter with instructions on what to do and how to enroll in a Medicare supplemental plan. We also get a lot of questions is, I'm turning 65, I'm eligible for Medicare, but I have a spouse who is under age 65 and not eligible. Can he or she stay on my plan? The answer is yes. You can continue your GIC benefits. You as the member must enroll in a Medicare plan, and your spouse can enroll in a non-Medicare plan with the GIC. So instead of carrying a family plan that you have while you were working, the GIC will allow you to change to an individual Medicare plan for you or your spouse, whoever's turning 65, and an individual plan for the member who is under age 65. Together, both those individual plans equal the family plan. So the question we always get is, do I have to do anything during the annual enrollment? No. If you're turning 65 in the future and you have a spouse who's in a non-Medicare plan, when you turn 65, your spouse can also elect any non-Medicare plan in the future. It does not have to be during annual enrollment. So you as the member can have any Medicare plan that the GIC offers, and your spouse who is under age 65 can have any non-Medicare plan that the GIC offers. If you and your spouse are Medicare eligible and turning age 65, you both need to be enrolled in the same Medicare plan. Only in the scenario where you're covering a spouse who's under 65 in a non-Medicare plan, you and your spouse can have different plans. If you are over age 65 and you are retiring in the future, once GIC is notified of your retirement, GIC will send the same letter to you and your spouse with your options to enroll in Medicare. Same options apply if you're eligible for Medicare, then you and your spouse must enroll in a GIC Medicare plan. Some things to keep in mind about the Medicare, some tips that we want to provide everybody is Medicare has two parts. There's Medicare Part A, which is hospital insurance, and Medicare Part B, which is doctor's insurance. Medicare alone does not cover all of your benefits. They pay some of the claims, but not all. GIC offers a supplemental plan to Medicare. So what that means is where Medicare leaves off on any claim payments, the Medicare plan you elect with GIC will pick up the balance. So that's the supplemental plans that we offer when you turn age 65. Only Social Security Administration can let you know if you and your spouse are eligible for Medicare. The GIC can't determine your eligibility for Medicare. You will have to contact the Social Security Administration to find out about your eligibility. Again, state law does require if you and your spouse are eligible for Medicare, you must join a Medicare plan with the GIC in order to continue your benefits. If you don't enroll in Medicare A and B, then the GIC coverage will end. We have to end your coverage according to state law. We do give plenty of notices. We do send a first notice. We send a second notice before any termination notice is sent to a member. It takes 2 to 3 months to do the enrollment with Medicare, and we will continually remind members when they need to enroll and select a Medicare plan. One thing we always get is, what happens if I'm turning age 65 and I'm going to continue working? If you're going to continue working and you are covering a spouse on your plan and you're going to continue working after age 65, we recommend that you can enroll in Medicare Part A, hospital insurance. It's free. There is no cost to you to enroll in Medicare. Same for your spouse. You will not have to enroll in Medicare Part B until such time you as the member decide to retire. So you can defer your Medicare coverage. Medicare will not penalize you if you continue working after age 65 and don't enroll in Medicare. There's no penalty. You have a 7-month window from your date of retirement to enroll in Medicare in the future. So a lot of times we get questions from members saying, do I have to take Medicare? Not if you continue working after age 65. We get questions on, can I put my spouse on my plan? My spouse has coverage elsewhere. Yes, you can add your spouse with the qualifying event, and you can add your spouse during annual enrollment. GIC will require a copy of your marriage certificate to add your spouse to your plan. If you are retired and your spouse is over age 65, at that time you put your spouse on the plan, GIC will ask for proof of Medicare enrollment in Medicare Part A and Part B. Another frequent question we get from members is, I'm covering a spouse under my insurance who is age 65 or older. I'm retired. Does he or she have to enroll in Medicare? The answer is yes. If you are covering a spouse under your GIC health insurance policy at age 65 and your spouse is working elsewhere because you, the member, are retired, you have to enroll your spouse as well as yourself in Medicare when you turn age 65. So I think that covers a lot of the general questions. I'm sure there's some in the chat that Erica will be pulling up, but
Yes, there are a few kind of more specifics. So I've marked them all as wanting to answer them live. So give me just a minute while I make my way through them.
no problem.
Thank you. Let's see. So one question we got is with respect to how long it's taking the Social Security Administration to reinstate folks for their Part B or other parts. And wanting to just understand a little bit more about why our deadline is 60 days. And if there's anything that can be done to extend that, I can go ahead and answer the latter part of that question, that 60 days is the deadline. But Paul, if you want to speak to why it is that we have that 60-day deadline and what that means for folks trying to reinstate through Social Security.
It sounds as though a member was notified that they have to enroll in Medicare Part A and Part B with GIC. A second notice was issued to the member. The member still did not enroll in Medicare Part A and Part B, and we had to terminate their Part B, their Medicare benefit, their GIC benefits, because they did not enroll when they were first eligible. If someone loses their benefit with GIC because of failure to enroll in Medicare Part A and Part B, we tell people you have to take immediate action with Social Security to make sure you get the problem resolved with Social Security. There may be an issue with earnings, eligibility, etc. with Social Security. We don't have the reasons why there was a delay at Social Security, but we put the 60-day window in because we need to know that the member is working on getting their Medicare benefits restored with Social Security. You can contact the GIC and let us know there was an issue and that you are resolving that issue with Social Security, and we will note your file so that we can keep that in mind in the future that you're working on your benefit. But there are some people we just have no idea why they didn't enroll in Medicare, and the coverage remains terminated, and we can't keep the record open forever. So we've put a 60-day limitation to request reinstatement. Now that's only if you're terminated throughout the year. Members can rejoin during annual enrollment. During annual enrollment, you will have to provide proof that you have your Medicare A and B coverage, and we will allow you and or your spouse to come back on during annual enrollment. But the time frame is in there because we are not sure why a member is not enrolling in Medicare. If there are issues with Social Security, I encourage you to contact GIC. We will note your record that you are working on that. But it just can't leave the record open for a whole year and contact us at any time saying you now want to enroll in a Medicare plan. So, but again, this is only in situations where we ended up terminating someone's benefit for not enrolling with Social Security. There's a few situations like that, but most people follow the instructions and enroll in Medicare A and B when they get our initial letter.
Thank you, Paul. A couple of other retirement-based questions. So one, if I retire at age 60 due to my disability, do I still carry my insurance? I know that's a bit broad, and you probably have some nuances to get to there.
No, the simple answer is yes. If you are retired from the Commonwealth or a municipality and you are eligible to collect a state pension check, you are eligible for GIC coverage.
Thank you, Paul. All right, getting to our next retirement-focused question. Let's see. If both my spouse and I are 65 plus, but I carry the GIC family plan and do not plan to retire for at least 6 more years, do we both stay on the family plan, or does my spouse have to go on Medicare plus the supplemental?
If you, as the member, are still working after age 65 and you're covering a spouse, you can defer your Medicare Part A and Part B enrollment, as well as your spouse can defer the Medicare Part A and Part B enrollment because you are still working. You are not retired. And there'll be no penalty. But yes, you can defer that and then enroll in a Medicare plan when you retire in 6 years.
Great. Thank you, Paul. Let's see. All right. I think we have one more retiree question for now, and then we'll move on to some other items. Um, let's see. If my wife is turning 65 next year, the member is older than his wife. If she retires next year, will both folks get a letter from GIC about Medicare sign up?
In
Or
that
what?
situation, it's hard to determine who's who. If you, the member, are retired and over age 65, if you have a spouse who is approaching age 65, like I said earlier, 3 months before your spouse's 65th birthday, your spouse will get a letter from the GIC.
Great. Thanks, Paul. So we still have quite a few retiree questions rolling in, but wanted to make sure we're getting to some of our other questions as well. Just want to note for everyone who has asked, this recording and the presentation will be available following this week's session. So we're going to wait until all 3 sessions have been completed, and then we'll send out an email to folks who registered for the webinars, where they'll get the slide deck that we're going through today, as well as access to all 3 of the recordings. So keep an eye out on your email for that. A question we get year after year, and there are quite a few of them here in the Q&A, is about individual plus one insurance coverage, whether it's something that the GIC considers, if it's something that we're going to do this upcoming year. I can answer that, no. But wanted to just turn it over. I'll kick it over to Matt first to touch on this individual plus one option that folks really are encouraging us to look at.
Yeah, thanks, Erica. And so this is an option that we regularly evaluate, and we will continue to regularly evaluate to see if it's something that that makes sense for us to add to our plan offerings. We are very well aware that there's a good deal of demand for it, so we certainly keep that in mind. I would say, I think one of the questions I saw was, how can members be involved in this? I think to the degree that you can help us understand your situation by contacting us through our online form, I think that would be helpful, and we can collect that feedback there. So we are interested in hearing the feedback.
Thanks, Matt. I think on a related topic, let me just pull the questions back up here. We've had a few questions about whether we've considered assistance programs or sliding scales for the employee cost of insurance. And Matt, if there was something that you wanted to add to those questions, probably along the same lines of what you just said about advocating, but I wanted to turn it over to you for that.
Yeah, no, it's a very good question, and we certainly see that on the health connector for those who purchase individual and sometimes subsidized care through the connector. That is a highly complex undertaking, but it is on our radar screen, and we do think about how we might do that. But there are currently no sort of near-term plans to do that.
Thanks, Matt. We had a couple of folks ask what the kind of aggregate increase was from last year, just as kind of a level setting. Matt or Jim, if you wanted to take that.
I defer to Jim on that. I think I know the answer, but I don't want to get it wrong.
The increase last year was 9.5% across the board. And then the individual rates, there's a presentation from the February meeting of last year that have the individual rates increases for each plan. I won't read all those, but the aggregate increase was 9.5%.
Thank you, Jim. Okay, we have a question about whether acupuncture is covered.
Probably a Cameron or Janine question.
Oh, sorry, was typing. Acupuncture is covered for the treatment of I'm sorry, trying to remember the language. It's related to opioid treatment as a pain management alternative.
Thank you, Cameron. Let's see here. While we've got you online, Cameron, we have a couple of questions about the change of the dental provider. So let's start at the very top. When will the new dental and vision go into effect, and how can we get access to the new benefits and cards?
Okay. If you are currently enrolled in our MetLife dental plans, your enrollment will automatically transfer to Altus without any action on your part. New cards should be mailed in June. You will have access prior to annual enrollment to the microsite that Altus is developing for us, where you can review the details of the plan, look up providers, and get more detailed information. We don't have that available yet, but it will be available prior to annual enrollment, and everyone should have their cards before coverage becomes effective July 1st.
Thanks, Cameron. We have a couple more dental related questions. So, dental eligibility, dental care eligibility can be a little bit confusing. Is it mainly for managers or any non-union active state employees?
Paul Murphy is our true expert when it comes to eligibility questions. But as a general rule, the dental and vision plans offered by the GIC to active state employees are strictly for non-union or management personnel. There may be some subtle distinctions I'm not aware of.
Paul, anything to add?
No, other than the plan is only available to people who are not covered by collective bargaining. So if you're covered under a collective bargaining agreement, you get your dental and vision benefits through the union. Everyone else would come through the GIC for the active employee.
Great. So relatedly, just to get specific with some of these questions, is dental coverage offered to housing authority retirees?
The retiree dental plan is available to housing authority retirees. Yes.
Great. Thank you. Cameron, one for you. Is vision through Altus or VSP?
VSP is the vision carrier. Altus is sort of the master contract, as you will. So they are contracting directly with VSP, and we are contracting directly with Altus.
Great. Thank you, Cameron. Another vision related question, is vision coverage available to those that work in higher education?
If you are covered under a collective bargaining agreement, no.
Great. Thank you. If someone retired and didn't opt into our dental, can they now reapply through the new carrier, Altus?
If you have previously participated in the retiree dental plan, you cannot re-enroll.
And if you have any specific questions about your case, please reach out to us via our modes of contact that we've listed, and I can put that back up.
Yeah.
Let's see. When will the FY26 premiums be released? Matt or Jim? I suppose I could answer that too, but
defer to others, maybe Jim or Paul.
We'll present the rates at the February commission meeting for a vote of the commission, right? It's voted there, and then within a month after that, municipal rates are provided. Go ahead, Paul. Sorry.
No, that's correct, Jim. The rates are voted at the end of February. Then GIC staff have to do the calculations for all of our health combinations, et cetera, distribute them to agencies, but they will be in the benefit decision guides online right before annual enrollment starts.
Yep.
And on our website.
Thanks, Paul. Relatedly, will coordinators be provided a handful of printed guides, and will retirees be mailed printed guides?
For the coordinator piece, yes, we will send a small supply of books to agencies once they are ready. Those will go out immediately prior to annual enrollment. On the retiree side, the books go to anyone who retires prior to July 2023. We encourage everyone to use the online option for the book, but yes, it's a smaller number who get a book in the mail because we want people to go online and review their benefits directly on our website with the book.
Great. Okay, I'm going to swap spotlights over for our ASL interpreters, so hang tight for just a second. Let's see here. Okay, let's see. Paul and or Cameron, we have a few questions about generally how the buyout program works. So if you could speak a little bit to that.
Buyout program is offered twice a year, once during annual enrollment and later in the fall. To be eligible for the buyout program, a member has to be enrolled in a GIC health plan from January 1st, 2025 through June 30th, 2025. The member can apply for buyout during annual enrollment, April 2nd to May 1st. What that means is the GIC will cancel the health insurance effective June 30th, and starting in August, the member will receive a check or if they're working, in their paycheck, a premium equal to 25% of the full cost premium monthly for 12 months. So it's a one-time deal, 12 months, 25% of the premium. You do it during annual enrollment, and your health coverage ends on June 30th. It's only available to state employees and state retirees. It's not available to our surviving spouses and municipalities.
Thanks, Paul. Let's see. Sorry, just combing through these questions here. One question here, kind of related to the individual plus one, tangentially anyway. Why can't I get health insurance for my domestic partner of 10 years? I don't know if Paul or Andrew want to answer this based on our statute and the definition of spouse.
Trying to get my camera to come on. As you indicated, yeah, we are specifically authorized to cover dependents as defined in Section 2 of our statute, which refers to spouses. Since anyone who desires to get married can in Massachusetts, there hasn't been much pressure on the legislature to change anything on that regard. And it does create a lot of problems when you start, what kind of proof is there that people are in a partnership that should be covered versus one that isn't, it's temporary. So unless something changes in the law, we're continuing to cover spouses.
Thanks, Andrew. Relatedly, this one I think is for Paul. Can former spouses be covered under the GIC if they have not remarried? If so, if I remarry, can both a current spouse and a former spouse be covered?
I can give you the Mass law for covering a former spouse. If your divorce was final after March 27th, 1985, your former spouse can remain on your health insurance plan until such time either party remarries. Once either party remarries, the former spouse is automatically not eligible for GIC benefits on the date of remarriage.
Thanks, Paul. Okay, let's see. So we've gotten a couple of questions about the basic life insurance increase, when it will go into effect, and if there will be an associated cost, as well as if there's anything members need to do. Paul, could you speak to that?
Sure. The basic life insurance increase is going to take effect July 1st, 2025. So anyone who has coverage before July 1st will have the $5,000 worth of basic life. Effective July 1st, anyone eligible for the basic life with GIC will be automatically changed to $10,000. There's no enrollment needed. As a member, you do not have to do anything. We are working with, as well as with the life carrier, to establish the rates for July 1st, and those will be publicized in the benefit decision guides as well. We have a line in there saying about the basic life insurance. That'll be in the book when we finalize the rates for annual enrollment. But you as the member do not have to do anything for that increase. We are working with our insurance carrier to also, at some point in July and August, send out new life insurance certificates for the $10,000 coverage to all the members enrolled.
Thank you. So we have a couple of questions about like health club or health and wellness benefits through the GIC. Wondering if we have any plans to reimburse more through our carriers. So I don't know if Matt or Jim, you want to take this and perhaps kick it to a member of the team.
Jim, I'll kick that to you. My understanding, well, look, I think we always evaluate the coverage through our plans, and it's helpful to have the feedback from our members. Jim, anything you wanted to add to that, or someone on your team?
No, Matt, I don't have anything to add to that. That's right.
Thank you. So I have a question here that I'm not entirely sure I have phrased properly, but there seems to be a rumor that if you have a plan for over 10 years and you're no longer working after 10 years, you can still have that plan. I think I alluded to the fact that it's a rumor, unless Paul wants to tell me I'm wrong. But Paul, if you could speak to that, that would be helpful.
That one is a little tricky. If you are enrolled in a plan, you can stay in a health plan with GIC for more than 10 years. Any plan that we offer during annual enrollment, those offerings are available to everyone. To be eligible, though, for GIC, you have to, one, if you're an active state employee, you have to be working full-time the required number of hours, be in a benefited position, and you continue your GIC benefits. If you are retired, you have to collect the monthly pension to be eligible for GIC benefits upon retirement. So I'm not too clear what the 10 years is, but there is no restriction for a member to be enrolled in a plan more than 10 years.
Thanks, Paul. I had another question here about, and I'll try to simplify it. When an employee enters an update or updates their address within our system, so the portal, is it communicated to the healthcare provider at any point, or is that something that needs to happen separately for the member and their provider?
All address changes done through the portal, as well as by GIC staff, if an application comes in, are automatically sent to the carrier weekly.
Great, thank you. And when participating in open enrollment, if let's say the person goes in on April 2nd and they make an election and they need to make a change, can they change that during annual enrollment, so long as it's done before the close of annual enrollment?
Yes, you can change your mind during annual enrollment about the health plan election you made. If you do it through the portal, you will have to complete electronic forms or a manual form and send it to GIC. The portal will not allow you to correct that. The coverage goes into our system for July 1st once you make that election. But if you change your mind, which you can do up until the last day of annual enrollment, you will have to complete enrollment forms electronically or manually and mail them to the GIC, and just put a letter with it stating that you are changing your mind and you wish to have this health plan election for July 1st, so that we know what plan is primary after the date.
Okay. Um, Will anything be changing about the hearing aid benefit? Might be best for Cameron.
There are no changes, no plans to change the hearing aid benefits at this point in time.
Great, thank you. Let's see. All right, just scrolling through all of our questions here. So we have quite a few kind of personal specific questions in here. If you have noticed that your questions aren't getting answered, definitely take a look and see if it's personal in nature. And we can also respond as such in the Q&A. We've had a couple of questions about expecting to see higher or additional deductibles, and wanted to ask if that's going to be an option going forward, higher deductibles, or if folks can expect to see higher deductibles. Matt, if you wanted to take that or kick it off.
So for fiscal year 26, we have not proposed any changes to deductibles. I'd say at the GIC, we've tried as hard as we can and successfully now for many years not to use increases in deductibles and copays as a cost shifting budget type mechanism. And I don't, and I would expect that that would continue. We're going to always try to keep those stable as we can.
Thanks, Matt. Going back to our questions here. Do any of the GIC plans for active employees cover functional or integrative medicine? Cameron?
I'm not sure what's meant by integrated medicine. I would urge that member to reach out to us using the contact with GIC. It sounds like there's something specific you're asking about, and I'm not sure, frankly, how to address that.
Thanks, Cameron. Yeah, that, and you could also reach out to the plan that you currently have to discuss what benefits are available. We have a geographic question. This person lives in Massachusetts and they have WellPoint Community Choice. Are they able to see providers in New Hampshire, or does it depend on the service and the provider?
Community Choice is limited to Massachusetts providers only and is not even available on Nantucket or Martha's Vineyard. So it is considered a regional plan. If you need to see providers in New Hampshire, I would highly suggest changing to another plan at annual enrollment.
Thank you. Cameron, I noticed in the Q&A that you marked you wanted to answer live about the employee buyout program and whether or not an individual is eligible. I'm not sure if Paul had already touched on what you had also wanted to say there.
Oh, it wasn't me that wanted to say it. I just wanted to make sure that
Got
Paul
it. Got it. Okay, great. We have another question around dental. Is there any consideration for a couples only dental option for retirees, as most of them are unlikely to still have dependent children?
Yeah, unfortunately, we run into the same issue when examining employee plus one on the dental side that we do with medical. And we've opted not to add that premium band for much the same reason.
Right. And Cameron, we had one question here actually wanting to better understand what individual plus one meant. And I think to shed a little bit more light on the impact that would have in terms of the risk. Is that something that you could speak to?
Sure. There are basically three main categories that premiums get broken down to by membership. You can have what the GIC does, where it's either or, it's individual or it's family. You could have an individual, employee plus one, and then family. Now that employee plus one, that captures spouses. It also tends to be single child households. The reason we have not added, the third option is to differentiate where you've got employee, employee plus spouse, employee plus any number of children, and then the whole family. So what that ends up doing is it pushes those with family coverage. Those expenses get even higher. And one of the considerations we have to keep in mind is because the GIC's benefits for public employees tend to be richer than much of what can be found in the private sector, we did not want to place a higher burden on those members covering a whole family. You know, that's a big part of the rationale behind the decision not to add additional enrollment bands.
Thanks, Cameron. So I got a couple of requests to go back to a few slides. So if you could bear with me while I breeze back to the slides in question. Folks wanted to see the legislative mandates that have popped up. So there's this one here, the PACT Act. And again, the presentation will be available following our last annual information session on Thursday. So these are the mandates that are in place. Just to go back for folks. And let me just pull up some additional questions here. I had another question to go back to the slide that showed our projected increase, which is here. So the low end projection is 8.5%, high end at 12.5, with the expected aggregate at 10.5%.
Yeah, and so this is still, you see a range here because we have not yet finalized our rates. And as we've mentioned elsewhere in this presentation, that happens when we present to our commission on February 27th our rates for their consideration. And we haven't yet, the commission has not yet voted on the plan design changes that we walked through earlier on the deck. So all of those and the ongoing work of the GIC will finalize rates over the coming month or so. I wouldn't expect it to vary widely or dramatically from the 10.5% average increase as noted here on this slide. But as we've noted elsewhere again in this presentation, that will vary. The actual increase by individual health plans will vary from that average.
Thanks, Matt. Let's see here. So I've had a couple questions about whether or not the Q&A here will be also available after this session. What we typically do is, to avoid having any personal information, we'll comb through the questions and answers here, and we'll pull some so that they're more generic in nature. And we will include them in our FAQ website. Emily, if you could drop the FAQ link again into the chat to help folks, that would be very helpful. And let's see, we have a couple more retirement related questions. One for Paul: what are the options for retiring in terms of GIC before age 65?
If you retire before age 65, then all of the plans that are available to the active employees are the same plans that are available to you as a retiree under 65.
You. Um, Can children, so if a retiree is eligible for Medicare, and the spouse is covered under GIC insurance, can children under 25 still be covered on GIC insurance as well?
Yes.
Thank you. I have a question here. Will questions not answered in this session be answered afterward? Again, we'll have to comb through some of this information to make sure that there's no personal information in there, and we'll resend the FAQ links. Um, dental and vision, are dental and vision covered for housing authority employees?
Active employees of any authority are not eligible for GIC's dental and vision plan.
Thank you. Okay. So we've had a couple of questions about new coverage levels for diabetes medications and insulin, as well as some of the enhanced fertility benefits. When we brought up the slides about our mandates that have come in this year. There's more information to come on those. Many of these changes came in at the very end of the calendar year, and so still working with the legislature and others to put those mandates in place. Matt, is there anything you wanted to add?
Can you say that again, Erica? Sorry, I was answering a question.
Oh, sorry.
Sorry.
So we've gotten some questions about new coverage for insulin and diabetes, as well as the fertility coverage. And as I was saying that it's just going to take a little bit of time for us to get that in order, as those mandates came in really at the end of the year. Just wanted to know if there was anything that you wanted to add to that.
Nothing to add to that. Still under development
Yep.
as we review the legislation.
Great. Great. Okay. All right. So the rest of the questions that I'm seeing here are pretty specific to individuals. Actually, we have one, is PT physical therapy covered?
Yes, it is.
Yep. Thank you. Thank you, Cameron. Okay. Paul, Matt, Jim, anything that you would like to add that we didn't cover in questions today that we might typically get?
Not that I can think of. Defer to others.
No, can't think of any.
Okay. I did get another question. They're still coming in. Um, a follow-up on a question about plans available to retirees before 65. Will the plan's cost be equivalent to active employees or more? I know it's kind of a difficult question to answer, but we're going to try.
No, the same plans are available that active employees can participate in to retirees under age 65. Please keep in mind that as a retiree, there are different contribution levels based on your date of retirement. So if you retired before July 1st, 1994, you pay 10% premium. If you retired from July 2nd, 94 through October 2009, you pay a 15% contribution. And anyone who retires after 2009, retiree pays a 20% contribution. So access to the same plan is available, but your contributions are based on your date of retirement, and that is spelled out in the benefit guides.
Thank you, Paul. All right, let me see if any additional questions have popped up here. Why not hold a special meeting for retirees only? That's great feedback. It's something that we have considered. And I think with our lean staff right now, it's not something we have the bandwidth to do at this very moment. But as the person who oversees external affairs, I appreciate the feedback and we'll certainly take it under advisement. So thank you for that. Let's see.
There's a couple of questions, Erica, about basic life. I know we touched on it a couple times, but it may be helpful to just restate
Sure.
the change to basic life. So there was language included in last year's budget that expands the basic life benefit from $5,000 to $10,000. That will be effective on July 1st going forward. I don't know if there's anything more, Jim or Paul, that we might add to that, but that's the very basic.
Yeah,
Thanks,
and that
Matt.
change is automatic. There's no action required on anyone's part.
Correct. And the rates will be published in the guide immediately right before annual enrollment.
Great. Does additional life insurance coverage continue to be available through the GIC?
Yes, there are no changes to the supplemental life insurance that's available to members.
Great. Okay. Well, the remaining questions that I see here are pretty specific to individuals and retirement, specific retirement questions. So I encourage you, if you didn't have your question answered live today, to please reach out to the GIC and or your health plan, and we can get those more personal questions answered for you. We have another session this evening at 6 o'clock. It's going to be really the same material. And then again on Thursday at 9 a.m. Again, same presentation, just wanting to offer additional opportunities for folks to engage with us and to learn from these sessions. So if you'd like, you're welcome to join those. They'll be streaming live on YouTube as well. But please stay tuned for an email next week that will provide you with the slide deck, the recordings, and links to our FAQs. Matt, or anyone else on staff, anything left in closing that you'd like to add?
Just to thank everyone for joining us today. Thank you to the staff for diligently answering questions. As you noted, Erica, towards the end, if folks need additional assistance, we are always available to help you with a phone call or by reaching us through our online form, which you can find at mass.gov/GIC. Also want to just give one last plug to the online member portal. Again, you can find a link to that portal on our website. Through that portal, you can do almost anything that you need to regarding your benefits, and to do it self-service. We're always available to help, but this is an excellent tool for you to get information and to transact your business with the GIC. So just thank you. Appreciate you joining us, and hope everyone has a wonderful afternoon.